What is berberine and why is it being studied for PCOS? Hi, my name is Dr. Besma Faris and I'm a board-certified OBGYN with expertise in PCOS. Berberine is a natural compound found in several plants used in traditional Chinese medicine. It belongs to a group of plant chemicals called alkaloids. For centuries, these plants were used in herbal medicine for a variety of health conditions. Today, modern research is investigating berberine because it appears to influence many of the biological pathways involved in polycystic ovary syndrome or PCOS. PCOS is one of the most common hormonal conditions affecting women. It can cause irregular periods, elevated androgen hormones, insulin resistance, weight gain, and difficulty getting pregnant. Because PCOS affects both metabolism and hormones, treatments often need to address multiple systems in the body. This is where berberine has gained attention. Researchers have found that it may help improve insulin resistance, hormone health, and reproductive function in women with PCOS. So how does PCOS affect your body? And how can berberine play a role? To understand why berberine may help, it is important to understand what happens in PCOS. Many women with PCOS have insulin resistance. This means the body does not respond properly to insulin, the hormone that moves sugar from the blood into cells. When insulin levels rise, it can trigger the ovaries to produce more hormones such as testosterone. Higher testosterone levels can interfere with ovulation and lead to symptoms like acne, excess hair growth on the face and body, and irregular menstrual cycles. PCOS is also linked to metabolic problems. Women with this condition may have higher cholesterol levels, increased abdominal fat, and a greater risk of developing type 2 diabetes later in life. Because PCOS affects both hormones and metabolism, treatments that target insulin resistance can sometimes improve many symptoms at the same time. So now, the million-dollar question: can berberine improve insulin resistance in PCOS? The answer is yes, but it is not perfect. One of the many ways berberine may help women with PCOS is by improving insulin sensitivity. Studies show that berberine can lower fasting insulin levels and reduce markers of insulin resistance. When insulin levels improve, several other PCOS symptoms may also improve. Lower insulin levels can reduce the stimulation of the ovaries that leads to excess testosterone production. This can help restore more normal hormone function. Researchers have also found that berberine can improve blood sugar control and help support healthier metabolism. In some studies, it has been compared with metformin, a medication commonly prescribed for insulin resistance in PCOS. The results suggest that berberine may produce similar improvements in insulin sensitivity and blood sugar control. Another potential benefit is improvement in fertility in people with PCOS. Hormonal imbalance is one of the central features of PCOS. Many women with the condition have elevated testosterone levels and an abnormal balance between two reproductive hormones called luteinizing hormone, or LH, and follicle stimulating hormone, or FSH. Some studies have shown reductions in total testosterone and improvements in the LH to FSH ratio after several months of treatment. It is important to note that this does not mean berberine is a fertility drug. It suggests that improving metabolic health can sometimes restore normal reproductive function. But here is the problem. Metformin is a regulated medication and very well studied. We know a lot of information about dosing and the expected results from that dosing. But because berberine is a supplement, it is not as tightly regulated. This means that some supplement brands may offer a higher quality product than others. So how does berberine actually work? Berberine works through several biological pathways, which may explain why it affects so many PCOS symptoms. One of its main actions is improving insulin signaling inside cells. It influences proteins involved in this process, including IRS1 and mTOR. These proteins help cells properly respond to insulin. Berberine also appears to reduce inflammation. Chronic low-grade inflammation is common in PCOS and may contribute to insulin resistance and hormonal imbalances. Studies suggest berberine can reduce inflammatory molecules such as IL-6 and IL-1 beta. In addition, there is some research that shows berberine may also improve the environment inside the uterine lining by influencing markers that help support implantation. So, if you have PCOS, should you try berberine? Anytime you take a supplement, it is important to discuss it with your doctor since, like I mentioned earlier, supplements are not as reliably consistent as normal pharmacologic drugs. Most studies suggest that berberine is generally well tolerated. It may interact with other medications you are taking. Common side effects are gastrointestinal, like diarrhea or constipation. The most commonly studied dose is 400 milligrams taken 3 times per day, but again, talk to your personal doctor first. Or if you are in the state of New York, or any of the other states where I am licensed, you can book a telehealth visit with me. It is important to remember that berberine is not a cure for PCOS, and it should not replace medical treatment. There is growing research that suggests it may help address some of the underlying metabolic and hormonal problems that contribute to the condition. For women with PCOS who struggle with insulin resistance, high cholesterol, or metabolic symptoms, berberine may offer supportive benefits. It appears to work in a way that targets several important pathways involved in the condition. As research continues, berberine may become an increasingly important option in the broader strategy for managing PCOS and improving long-term metabolic health. What questions do you have? Drop them in the comments below, and I will do my best to do a future video answering your questions. Remember to hit like and subscribe, and I'll see you in the next video.